Ladies and gentlemen, thank you for your patience in holding. Please be aware each of your lines is in a listen-only mode. If you have a question during today's presentation, simply type your question in the chat pod located to the lower right-hand side of your screen. It is now my pleasure to turn today's conference over to Rick Ricciardi. Sir, you may begin.
Thank you so much, and welcome everyone to one of my favorite topics, TeamSTEPPS, and what we hope to accomplish today is to introduce you all to TeamSTEPPS for office-based care online. Before we begin, I'd like to take a minute to first thank my partners in this. To begin with is AHRQ, who have been a long-standing contributor and partner to TeamSTEPPS, working with AHRQ and other groups to build the TeamSTEPPS program, strengthen the TeamSTEPPS program, and implement the TeamSTEPPS program. Also like to give a shout out to Rangold, who has been partnering with AHRQ on the office-based TeamSTEPPS Care Online to give you what we are going to discuss today. And as a member of Rangold is Bridgetta Kraft. Dr. Kraft is my partner today, and I like to think of this as me being the warm-up. You know, you all been to concerts, and you know the main band comes on. Well, I'm the warm-up band. And then followed me will be the Rolling Stones or Dr. Kraft, who will give you more information about TeamSTEPPS. And lastly, but not least, I'd like to thank all of my colleagues at AHRQ and all the way back from Jim Battles, who was one of the originators of TeamSTEPPS with Heidi King from the DOD, to where we are at today. So it has been truly a program for about 10 years. It has had lots of iteration, lots of changes, lots of updates, and lots of uptake, both in the hospital, in long-term care facilities, in same-day surgery centers, and today in office-based areas. Also, for today, we will, Bridgetta and I will go through the presentation, and during the presentation, you are more than welcome to go into the chat box and ask questions. And a part of the team here will aggregate or look at those questions, and then we will answer them at the end. So we hope to be finished in plenty of time to have a Q&A at the end of the presentation. So if you could write all your questions in the chat box. With that said, I'm going to move on to the agenda. And what we hope that you will take away from today's presentation is why you all, wherever you are, whether you're in primary care clinics, ambulatory centers, same-day surgery centers, if you're administrators, if you're clinicians, if you're researchers, if you're policymakers, wherever you are, we hope to help you to understand why you would want to grab onto TeamSTEPPS and think about implementing it in your office-based or your ambulatory clinics. Second, we'll present some information on why we think you would believe that TeamSTEPPS could be useful to you as an intervention that could help strengthen the way that you deliver care, and which would benefit not only the teams that are delivering care, but the patients and their caregivers and the communities that you're serving. Following on that will be Bridgetta, who will be talking about what is involved in the TeamSTEPPS for Office-Based Care course online, and the most important thing is, how do you get involved for the course? So that's the agenda for today, and a little bit about AHRQ and how we got into TeamSTEPPS and coming about investing for over 10 years using public money to build TeamSTEPPS. First of all, AHRQ wants to do a better job of understanding the causes of harms, safety issues, whether it's error, diagnostic error, communication errors associated in healthcare. And how we do that, we have a grant portfolio. And if you go on AHRQ's funding announcement website, you'll see that probably about 30 or 40% of our funding opportunity announcements are directly related to safety. And so it gives those of the researchers out there, it gives you opportunities to conduct research to understanding the cause of harms. The second piece, and what we're going to be talking about today, is to apply knowledge to accelerate patient safety improvement in all care settings. And of course, one of those is TeamSTEPPS, which we're very proud of. But other areas, if you go on AHRQ's Patient Safety Tools and Resources website, you'll notice that there's a list of tools that are available to those of you in ambulatory care settings that can help reduce patient error or enhance patient safety practices. For example, we just released 3 new items, one on community-acquired pneumonia, one on improving and engaging patients in primary care settings, especially in transitions of care, and then the last is about improving your testing for diagnostic processes. So how can we do a better job of doing diagnostic testing and making sure that there's no errors committed in informing patients and having patients engaged? And then we also have a whole robust portfolio on healthcare-associated infections. And we are also very interested in building system capacity, which TeamSTEPPS can do, in building your capacity to develop and strengthen teams throughout your health system, but particularly for today in ambulatory clinics. So what is it about teams? Why are teams important? And how can we get that across to all those who we work with? I'm sure that you have all thought about that. I certainly have. I've been an NP, a nurse practitioner in practice, for almost 40 years. And I could reflect back on some teams that I worked with that didn't go so well, and some that were outstanding. And when you think about those two, and I'm sure you all have worked with those kinds of teams, when you think about those two, you can immediately come to some thoughts about what went well, what didn't go well, and how could I have made it better. So one of the ways that I like to think about it in a really strong team, and a team that's working well, that's optimizing, they work smarter. The individuals are working smarter and not harder. In poorly functioning teams where we really got to take care of our patients, we got to make sure they get the information, we got to educate them, we got to get them roomed in, we got to get them their vital signs taken, we got to make sure they're discharged properly. Yeah, we can do all that ourselves. However, we're working harder, but we're not working smarter. So the bottom line is, when really good teams, cohesive teams come together, we work smarter, we make less errors, and we actually are more fulfilled at the end of the day. Now, a little bit of background about how TeamSTEPPS came to be is that much of the research that we've put into this evidence-based intervention we call TeamSTEPPS comes from not only healthcare sectors, but research that was done in, let's say, the aviation industry, where it was critical whenever there's an aviation event that they do a root cause analysis, they find out how that all happened, and then they strengthen teams. So much of the science around team-based care comes from aviation industry, and some of it comes from the military. As you can imagine, going into battle, you want to have a strong, cohesive team, reduces morbidity, it reduces mortality. So along with that, we've learned that there's a large body of evidence that effective teams are associated with better patient outcomes. And I did a Google search this morning right before this presentation, and I went into Google Scholar, and I saw that there have been over 4,000 publications, both peer-reviewed and non-peer-reviewed, on the topic of TeamSTEPPS. And then I went into PubMed, and I found that there was 112 peer-reviewed publications in PubMed. Now, as you all know, PubMed doesn't cover all the peer-reviewed, but so you can see that over the course of 10 years that there's lots of evidence and science and implementation evaluation of TeamSTEPPS. Okay, so let me move on. Okay, moving on to TeamSTEPPS, to give you a little bit of background of how popular it's been, we have had over 6,200 master trainers that have been trained in the in-person training. And from those, there's been over 37,000 people trained by those master trainers. The materials have been translated into more than 20 languages, and it has been used by the World Health Organization all over the world to be developed and translated so that other countries, other health systems, other ways of delivering care can benefit from TeamSTEPPS. And as you can see from the slide, we've had lots of online sessions. Thank you to AHRQ and Rangold for delivering and the content. And if you're lucky enough, you might even listen to some of the presentations where you'll hear Bridgetta and myself talking during the presentation. So as you can see, TeamSTEPPS has really caught on. It's been really popular, and there's been a tremendous amount of publications around it. So a little bit more about the content, and this is the exciting part. TeamSTEPPS for office-based care is evidence-based, as I mentioned. And that's really important for those of you who are interested in, for example, the quality payment program or the value-based purchasing, or if you're part of an ACO or part of the medical home where you have to document how are you training teams and to demonstrate that you're getting value by looking at strengthening your teams. And how can you document that? Well, you can document the fact that you're using TeamSTEPPS, an evidence-based teamwork system, to help facilitate training and educating and implementing team-based care within your clinic. The materials are ready to use. They're there. There's multiple venues and formats for you to download them, and you know it's in the public domain, which means that there's no charge for you to access these materials or use them. Yes, there is a free lunch on this. You know, you are getting this based off of government money that's already been used to purchase these materials. So it's part of your benefit for paying your taxes, if you will, to have these materials. TeamSTEPPS is composed of 4 teachable skills. And when you look at the evidence around why errors occur in primary care and how to strengthen both safety and quality, the 2 that rise to the top always are communication and leadership. And communication is the foundation of success for TeamSTEPPS. It's the underpinning. It's really where everything is focused on. And if you look at the tools that we use to help facilitate building strong teams, you can see that a lot of them have a human relations component. Because much of what's around teams is fundamentally based on trust. And if you don't have that trust factor, one, how can you get that trust factor amongst your team, and what sorts of tools are out there to help you develop trust? And 2, if you have that trust factor, how can you improve upon it and sustain it in a methodologically sound way? And using TeamSTEPPS is one way to do that. Of course, leadership is much more than about who's in charge. It's about how to direct and coordinate assigned tasks. It's about motivating team members. It's about facilitating optimal performance and integrating best evidence or evidence-based practices within your team. And it also is focused on evaluation. Now, within TeamSTEPPS, we take the perspective of both there being a traditional and a situational or a transitional leader, where all throughout the healthcare continuum, different members of the healthcare team at some point along the continuum are the leader. They are the person in charge. And then, so they need to take responsibility and characterize that leadership in a way that's meaningful for everyone on the team. And the more unique areas within TeamSTEPPS, conceptual areas, are situation monitoring, which is how to develop a common understanding of the team environment. It applies to strategy, monitoring what's going on. For example, this is I know you're all familiar with the busy clinic. In one of my clinics recently, you know, it's been flu season. And those of you who have been inundated by by flu patients, you know that some are sicker than others. So when your clinic is packed, there's individuals that are keeping an eye on how each of the providers are moving, how the nurses and the team is moving, and making sure that things are not getting missed, patients are not waiting too long in one area, or the treatment room is getting backed up and there's a certain patient that needs to be moved into the treatment room quicker. So it's about monitoring your environment and your situation and having really eyes on everybody and communicating that in an effective way so that, one, you're working smarter and not harder, and two, you're enhancing quality and safety. A lot of that comes from experience, but I can tell you that with the TeamSTEPPS principles, a lot of it can also be taught, and that will accelerate your ability to take that experiential knowledge and build on that in a much more rapid way, both using simulation through TeamSTEPPS or real-world TeamSTEPPS in practice. And lastly, the concept of mutual support, which is really how to anticipate other members' needs, how to shift workload to achieve balance, and to really keep an eye on each other during high times of stress, so that we really as a team are watching each other's back. We are moving in when we need to move in. We're not afraid to step up and help team members who need perhaps a break. So also part of this, which I actually find to be extremely helpful and have often used in my clinic, is the use of videos. And you have the link there. TeamSTEPPS has videos that are specifically tailored to the office space. So when you see the teams, they're all in a clinic and they're working and discussing real life issues that happen every day in a clinic, whether it's around communication issues and these interpersonal relationships that need to be fine-tuned, whether it's a leadership issue or whether it's situation monitoring or mutual support. So that takes me to the end of my part of the presentation, and now we're going to be moving on to Dr. Crafts, Bridgetta, who, like I said, she truly is a rolling stone, and she'll be taking you into the course, and she's the premier and main act of this presentation. So, Bridgetta, I'm going to turn it on over to you.
Thanks, Rick. I appreciate it, and I do apologize for my voice today, like I think most everybody else around the country, battling bugs and allergies, but we'll see how it goes. So when you look at the Master Trainer courses, I first off just want to say thank you all for joining us and for your interest in working to enhance the safety and quality of care provided to the populations you serve, as well as building effective teams, because that's what this is all about. So I'll be covering the topics that are listed on this slide for the remainder, and then, as Rick mentioned earlier, we really want to hear from you. So the courses are available online at no cost, and then upon a successful completion of the cohorts, you'll receive a Master Trainer Certificate of Completion from AHRQ, as they're instrumental in the development of the online training and really stand behind its rigor. There's technically no official certification because there's no certifying body of TeamSTEPPS at this point, but you can certainly consider and call yourself a Master Trainer. This course, the way we've laid it out, it not only teaches you about TeamSTEPPS, its implementation in the medical office, primary care, ambulatory care environment, but it also prepares you to be able to train and coach others. And that's how you build that cadre and really build that momentum within your organization. The Master Trainer course will help you become familiar with TeamSTEPPS, their tools, and the methodology. And as Rick had the link on his previous slide, we do have videos and scenarios used throughout the course, and they just depict that actual use of the various tools, as well as opportunities where a tool could have been used to achieve a better outcome. And so with that, I'm going to advance to the next slide. So the Master Trainer courses versus the individual modules that are also available online. And you can choose what works best for you. So the TeamSTEPPS for Office-Based Care cohort is the exact same curriculum in terms of the team competencies and tools as the individual modules. And you can see basically from this summary slide that both course options are going to offer you CE credit. They're free, and you have access to frequently asked questions as well as the ability to ask experts questions via email. The difference remains in the Master Trainer certificate, which can only be obtained if you're enrolled in one of the office-based care cohorts. And those in the cohort also have access to webinar recordings and that opportunity to have a teach back to a Master Trainer. And if you're enrolled in one of the cohort courses, you do have to complete all course requirements in a time-limited frame, which is 120 days from the first day of the course, not from the first day that you start the training. The non-cohort option or the individual modules have no time limit. So you can start whenever you want, take as long as you want to finish, and you can choose to do one module, two, or all 11 modules. And so when we talk about continuing education credit, we are worked with 3 accrediting bodies, that you see listed here. So the cohorts and the individual modules both offer that joint accreditation, which is a leading model designed to improve interprofessional collaboration, and that's what we're all working towards. And so we are working with the Accreditation Council for Continuing Medical Education, or ACCME, the Accreditation Council for Primary Education, ACPE, and the American Nurses Credentialing Center. And most allied health professions and other non-clinical professions are able to use this JA continuing education credit and the certificate that you'll receive so that you can talk with your organizations. And as I mentioned earlier, after completion of each module that is accredited, you're able to print your certificate then. So you will get an individual certificate for each module that you successfully complete. So now, what to expect once you enroll and join the cohort? So to prepare you to become a Master Trainer, the Office-Based Care Online course includes the TeamSTEPPS Fundamental modules, which is modules 1 through 7, as well as modules on change management, coaching, measurement, of course measurement, and implementation. It also includes that opportunity to present some of what you've learned to a Master Trainer in the form of a teach back session. And these sessions, we just want you to illustrate how you would teach the course to others or how you plan to utilize what you've learned in the course at your organization. And then, as I mentioned, there are 3 webinars that you're required to watch, and there's a library, if you will, of webinars that you can choose from on a variety of advanced applications of TeamSTEPPS, just to give you a little better idea and an example of how it has been used and the positive outcomes. So enrollment. Right now, enrollment's open through October 2018 with possibility of extension. 2 cohorts are currently open right now, and 6 more are going to become available between now and then October. And actually, our next cohort is starting next week on March 14th, that's Wednesday, and registration is currently open for that course now. And I just want you to keep in mind that participants do have 120 days to complete all their work, again, starting from the day the course opens. Now, you can certainly enroll in a course after it's already opened and work at your pace as long as you complete it by the end date of the course. And sorry, I bumped the slide ahead a little prematurely. There is no mandatory requirement to register in the office-based care online courses as a team. You can certainly enroll in it as an individual, but if you do have a team and you want to participate together, each team member does need to register and enroll individually in the pre-work. And that way we'll able to provide you each with your CE certificates at the end. Then we do have, as part of the pre-work, an implementation planning worksheet, kind of just give us an idea of what you're looking at, what your main challenges and opportunities are that you'll be using the TeamSTEPPS tools and strategies to provide enhanced outcomes. And you can certainly all, as that team, submit that same implementation planning worksheet. You don't each need to develop your own. Okay. All right, so now, this is close to our last slide. We really want to hear from you, your thoughts, and be able to respond to your questions. And we really hope that you're going to be able to help us by engaging in that discussion about TeamSTEPPS and office-based care. So based on what you've heard so far, do you think there's an interest in your organization or you as an individual to promote TeamSTEPPS for office-based care? If so, go ahead and in the chat maybe share some of the methods and resources that you have for sharing this opportunity, reaching out to others. What are your thoughts? And have we met your needs in providing the information that you were looking for about TeamSTEPPS for office-based care? And so as I'm coming to the end here, I just really want to wish you all the best as you continue to explore how we can further improve teamwork in healthcare. And in a few days, you'll be receiving information about TeamSTEPPS for office-based care for you to share with your colleagues or others in your organization. And we really look forward to having you being a part of our TeamSTEPPS online course. So staying connected with us, you see there on the slides, you can certainly send a question regarding TeamSTEPPS for office-based care, and that's at obc-questions@tslms.org. If you're interested now, want to register on the site and enroll in the courses, that site is www.tslms.org. You can certainly sign up for our patient safety listserv, and that's at https://psnet.ahrq.gov/issues, ISSUES, or why not join AHRQ's LinkedIn page? Really connect with us there. And that's https://linkedin.com/AHRQ-TeamSTEPPS/. So now we'll take more questions, and I think I'll turn this over to you, Jen.
Thanks, Bridgetta, and thanks, Rick. That was a really helpful onboarding and overview of TeamSTEPPS for office-based care online. One of the questions, a little bit more logistical related, to provide a little more clarification on the TeamSTEPPS cohort, so becoming a master trainer through the cohort versus participating in the individual modules. So if you go through the office-based care individual modules, can you go back and then complete the cohort to become a master trainer later, was the specific question.
Okay, thanks, Jen. I can take that, and that's a great question. You can certainly go back and take it if the time isn't right now and you want to take the individual courses. Certainly then you'll go back and enroll in the pre-work, and then once the documents are submitted, we will send you the link and key to enroll in that cohort you requested. And once you get onto the TS-LMS site, you will see the listings of the available cohorts that are open now with their course start dates. And certainly if you're looking and want to know maybe what time frame other courses are starting, you can certainly send that question to obc-questions@tslms.org.
Great, thank you. And just to also reiterate that participants can sign up individually for these cohorts, but if they have a team that they'd like to, take it together, they could sign up, but for the same cohort, but they must do so individually.
That's correct, so that we get your information and we're able to make sure you get that credit individually for it and your CEs.
Right, and so if you participate, you'll receive, I believe you receive CE credit for each module, but I believe it comes out to not quite 12 continuing education credits. So I think that someone else had asked that question. This is probably a question for both Rick and Bridgetta. So ideally, who should teach TeamSTEPPS for office-based care? I imagine that this is in the context of, okay, so who should participate, who should attend this cohort and bring it back? What type of individual would you say?
Well, Bridgetta, I guess I'll start. I've been involved in, this is Rick, been involved in a lot of TeamSTEPPS training. I've been on the site for in-person and been involved in the online or distributive learning. I think what we found is that because it's a TeamSTEPPS, all members of the team can be part or lead the TeamSTEPPS implementation in your practice. Now, the person who typically is involved is the person who has the most interest, or someone who is willing to take on a quality improvement initiative. Sometimes it's been individuals that have been designated as the quality improvement, if you're lucky enough to have, and many primary care practices and office-based practices now, particularly as they're getting bought out by health systems, will have safety officers, quality improvement officers, practice transformation. There's lots of different names for these individuals, but specifically they're individuals that are looking at ways to improve the practice. So to answer your question, they can be a physician, they can be a nurse, they could be someone who is interested in quality improvement at the health system or the practice level. Within your own practice, again, it could be anybody. It could be, we've seen physicians, we've seen nurses, we've seen nursing assistants, we've actually seen administrators as well. So it all depends on your team, who's the best prepared, who has the time, and who has the enthusiasm. And while I'm there, I see another question, which I think is a good one, is about how do you get buy-in from leadership, which I think is tailored to that question. And also, we've identified that as part of the office-based TeamSTEPPS, which was kind of an iterative process from the previous TeamSTEPPS. We incorporated that content in Office-Based TeamSTEPPS, there's a module on implementation which discusses how you would involve individuals who are the decision makers, whether it's the C-suite or the CEO, the CFO, whoever, or whoever within your chain. You would need to get buy-in. What we do know about implementation is it's a top-down and bottom-up process, and you also need a champion. So that your question, your fundamental question, who is that champion? It could be anybody. I'll stop there, Bridgetta.
No, I agree. You covered it, and the only thing that I think it's important to stress is you can't do it alone. You need a team, and so grab some of those folks that have the same interest and see the opportunities that are in your office or clinic where there's that opportunity to make improvements or make some changes, let things move a little smoother, and develop that change team. It could be 2 or 3 people, but work together. It does take a team. It does take a village.
Yes, I completely agree with you both. And since I have 2 experts here on the phone, this is kind of a general question. So what do you find successful teams do before either signing up for a cohort or actually going to implement TeamSTEPPS?
I mean, is the question how are teams successful in implementing TeamSTEPPS? Is that what you think it is? Or
yes.
What are some, that's a great question. I think teams that are successful in implementing TeamSTEPPS have, like I said, they typically have a champion. They have buy-in from senior staff or decision-making staff, and role modeling from senior staff and the champion. Because with any implementation today in ambulatory care, we know there's competitive, it's a competitive marketplace. We're doing patient-centered medical home, we're doing ACOs, we're doing quality improvement in all areas. It could be specific to a disease process. We want to improve quality in diabetes care. We want to improve quality in hypertensive care. We want to improve quality in our immunizations for children and adults. So we have multiple competing quality improvement initiatives going on. And one thing that TeamSTEPPS, which is, I find the beauty of it, is that one thing that is necessary in any quality improvement activity that you do is to have a team. So TeamSTEPPS is really an intervention that is irrespective or without a disease process. You can use it to implement any weakness in your program or in your care delivery fundamentally. So what you need to have a successful one, you need to have some revolving of the team around a specific issue, something that everybody cares about. Whatever that is, that could be unique to your setting. Find something that everyone cares about and wants to do a better job. And you make that your metric. Say you want to improve that. And one way you're going to improve it is by, and often for these kinds of things, you're going to strengthen your team. And one of the beauties of TeamSTEPPS is that we like to call it a flex kit, meaning that the modules, although are part of the whole, but you can work on one area. And we know that in primary care, people don't have, with so many competing other things going on, people don't have time to sit down and spend an afternoon learning and going over TeamSTEPPS. So you could work on the communication modules and take that as your first toe into the water, your first bite, and test that and pilot test it. Or work on the leadership modules because you think you need to strengthen leadership within your team. And then start building on that. So successful implementation really revolves around a common priority issue which everyone wants to improve. 2, has a champion, has buy-in from leadership who are going to role model it, and then people are supportive of the intervention. That's my perspective, what I've seen from many implementations and also doing it within my own practice.
Absolutely, Rick. And as you listed them off, that's exactly what I had written here. And just can't stress enough that coaching, just-in-time coaching, and encouragement to others. If you pick a tool. Let's say one of the tools is briefs. So you're implementing briefs in your clinic, and one day it's busy, and someone says, "Hey, don't forget, we have to do our brief." Then, hey, that's great. You're bringing us back on track. Thanks for reminding us that this is what we have to do. This is what we've agreed to do, and that's important. And holding people accountable to the behaviors that, as a team, you've agreed to implement, and helping each other stay on track. And that comes with, mutual support, which is one of the beauties of TeamSTEPPS. That's the whole module, and helping with what tools to bring on that mutual support, and the trust, as you mentioned earlier, Rick, is so important. You can't move forward if you can't trust the people you're working with to have your back and to do the best for the patient who's at the top of the list there.
Thank you. Yeah, and I'd like to echo kind of what you both said, that it's really about gathering those small wins along the way and having a very specific focus. I think oftentimes we see a lot of teams and individuals, come into TeamSTEPPS or a cohort saying, I want to fix communication in my clinic, and that's just such a broad, ambiguous goal. So I think by kind of narrowing that down to something specific, whether it's a process or something you're already measuring, can kind of help drive that momentum. So I think we have time for one last question, and perhaps a good way to end this. Veronica asked,
Jen, can I just interrupt here? I just saw two things that caught my eye that maybe I wasn't clear on earlier. If you enroll and complete the individual modules, and if you complete all 11 of them, you will not receive a Master Trainer certificate. For that, I just want to be clear. The only way you can receive a Master Trainer certificate is if you complete the cohort. If you do the pre-work and enroll in the cohort courses. And I saw that question. And then one other thing, as you get on the site, that TeamSTEPPS 2.0 core curriculum is a different course from the TeamSTEPPS for office-based care. So what's available online when you go to the home page is the individual courses for TeamSTEPPS 2.0, and then the TeamSTEPPS for office-based care courses, the cohort and the individual. Sorry,
yeah,
Jen.
Thank you for, no, it's okay. Thanks for clarifying. And I think, is it a fair statement to say that when you participate in an individual module, I would say that might be used more as a refresher or a way to kind of go back and revisit something. But yeah, going and participating through the entire cohort, that's what you'll get. Then you'll become a Master Trainer. Did I summarize that? Okay, great.
Absolutely. Or if someone was interested and wanted to just review an individual module, just to say, hey, okay, yeah, I have a better idea. Maybe this is for us. There's that. But there's also an onboarding video that you'll be able to look at that gives an overview, again, of the courses as well. So that might be something you might want to look at and share with your leadership.
Great, thank you. So the last question I think to end on is along the lines of sustainment. And I know for a lot of folks that are on this webinar, this is probably an introduction for TeamSTEPPS and for office-based care. But when you think about sustainment, do you guys have any best practices or any stories from your personal experience that have helped when you've sustained TeamSTEPPS in your either one of the areas you've worked in, Rick and Bridgetta?
I can say that, Jen, when you mentioned look at your short-term wins and celebrate all those wins. Don't look for the data 6 months down the road. And sometimes when people are using the tools and we see the positive outcomes, we may say, oh, well, yeah, that's their job. Of course they're doing that. But not everybody does everything all the time. And so coaching to sustainment, keeping it at the forefront, adding it to your mission, your vision statements, and talking about it. Keep the conversation going. I think that all helps for sustainment. Put it into your policies if that is beneficial to you. But that's where I've seen the organizations that do that have been able to sustain the initiative. Rick?
Yeah, I mean, I would agree. That's absolutely. It's about a culture change, and we've had these discussions with other TeamSTEPPS implementers. It's really looking at TeamSTEPPS is an umbrella to try to improve and optimize teams and enhance safety and quality. But even above that umbrella, the bigger umbrella above that is the whole concept of having a culture change within your organization. So for example, using the CAPS survey, which AHRQ produces, which is the culture survey, or others, there's surveys that you can use for ambulatory settings on the AHRQ CAPS survey for ambulatory or primary care or patient-centered medical home. So are you seeing improvement in the culture, and is the culture, building teams and effectively developing cohesiveness? How to sustain that requires intentional, i.e. top-down, systems and practices, willingness to go the extra yard, to say this is important. This is important to our culture. This is important to who we are, what our core values are as an organization, as a clinic. Let's measure our core values over time and see if we're improving those. And then also to root out or to incentivize members within the practice or the health system that are meeting or exceeding our core values and are really role modeling that. So sustainment is not just a simple metric of measurement one time, as I agree. It's about long-term culture change, which for those of you out there on the line, I know you got to roll up your sleeve. This is hard work, doing culture change and getting individuals to change behavior, to change the way that they practice, to look at evidence-based methods, but also team-based methods, is hard. And Bridgetta and I didn't say that this was easy work. It's not. However, to be successful, you really do need a champion. You really do need people at the top that are taking this seriously and want to implement it. And that's where you get your sustainability and you get your culture change. And in the long run, everybody benefits. But it's not, as was said, short-term wins, but a long-term plan is what's necessary.
Thank you, and thank you both for that really helpful overview this afternoon. Just to reiterate, so if anyone would like more information, you can email us at the obc-questions@TS-LMS.org. And additionally, if you go to TS-LMS.org, the website, there's a short, 5-6 minute onboarding video that provides a little more information, and then you can create a new account. And once your account is authenticated, you can log in and see what, again, those options are with the cohorts, including when the cohorts open, and then the individual kind of on-demand modules that we mentioned. But we will be following up with you, and this webinar is being recorded, so if you'd like to revisit this or pass it along to colleagues or team members, we will send that to you in the coming days, and we will also send you the slides. So thank you so much, everyone, for joining us, and please keep an eye out for an evaluation. We really value your feedback, and again, please don't hesitate to reach out to us with any questions you might have. So thank you all, and enjoy the rest of your day.